Hi everyone, welcome. So this is Training for Birth. We did a live just a few weeks ago talking about birth prep, and tonight we are going to be doing a live talking about training for birth. So I would love it if you all would say hi or tell me where you're from in the comments. You can share how far along you are, or perhaps you're a coach or a fitness trainer who works with the pregnant and postpartum community, and you're here just for, a little bit of knowledge and education. I'd love to see where everybody is. I know I've got a few friends joining me, so welcome. Okay, so just a very quick introduction about me. My name is Jessica. I am a mother of two. Oh, welcome Toronto, 36 weeks along, wonderful. I'm a mother of two. I've been a certified prenatal and postnatal yoga teacher for almost 17 years. I am a nationally certified pregnancy and postpartum corrective exercise specialist. So I work specifically with pregnant folks who primarily are hoping to address issues they're having during pregnancies. So people who are experiencing like chronic SBD or that pubic symphysis disorder, people who have really severe SI joint pain and low back pain, people who have PGP or pelvic girdle pain, which is kind of one of those catch-all symptoms for anything that's going wrong in your pelvis. So I tend to work with specialized clients who have specialized needs. So I do some training for pregnancy for folks who are just looking to work out and stay fit. And Riverside, California, 37 weeks. Jackie, hi. Hannah, Tennessee. I love Tennessee. Salt Lake City, almost 28 weeks. Perfect. So I was just introducing myself as I let everybody else kind of filter in, and I wasn't going to start until we get just a couple minutes after 6 to make sure that everybody's gotten here and is all checked in. So Callie, living in Louisiana, 38 weeks. Oh, that's wonderful. Yes, so that's a little bit about me. I am a certified birth doula. I do pregnancy, birth, and postpartum education. And at 34 weeks is when I typically start doing birth training with my clients. So what is birth training? What does that look like? A lot of people think birth training from LA, 36 weeks, 32 weeks, perfect. Birth training is not just physical. It is a lot of mental, a lot of emotional preparation for the marathon of birth. So I began my prenatal care with my first child almost 11 years ago in a traditional OBGYN office. I knew after a couple of visits that it was not the type of care that personally I wanted. I wanted a little more of a holistic and natural practice, and that wasn't super common 11 years ago. So I ended up finding a really great midwifery center, a birth center that was run by midwives, certified nurse midwives, and I ended up having my first child in an unmedicated vaginal birth at the birth center. My second pregnancy, I ended up finding a office that had both a naturopathic OBGYN and a group of certified nurse midwives, and got my care through those ladies. I was also really, really fortunate to be able to do a mentorship with a naturopathic OBGYN in Arizona for about a year. She was a wonderful lady. She taught me a lot about caring for pregnant bodies and getting them ready for birth, no matter what kind of birth you desire. So, I'm here to support every kind of birth plan, every kind of birth scenario that you desire. I always suggest planning and prepping for your ideal birth scenario, whatever that might be for you. So everybody has a different understanding of what they want for birth, right? Some people definitely want to birth in the hospital. Some people definitely know they want to birth outside of a hospital. And whatever it is that you desire, I want to help you meet your goals or your desires for the birth scenario that you would like. So I just sent out a newsletter about planning for your ideal birth scenario. If you aren't on our newsletter subscriber list yet, definitely send me a DM at the end of this live with your email and say, please add me to the newsletter. And I will get you on our newsletter, and I'll make sure that you get sent out, sent this last Planning Your Ideal Birth Scenario newsletter, because there's a lot of really good information about how you go about planning for birth. So today we're going to focus on birth prep. Now, although I generally tend to start birth prep or training for birth at week 34 with my clients, you can start this a little earlier and you'll still reap tons of benefits if you're starting this at 38 weeks, or even if you only have a week left of pregnancy. You've got a week left, give or take a day or two. And you've got time to do some movements, to do some breath work, to do some meditation, to get your whole body, physical, mental, emotional body prepared for that marathon of birth. What it's also great for, the mindfulness activities that we're going to do today, the kind of mindfulness practices, is great for taking you into any scenario. So let's say you've planned for an unmedicated vaginal birth, but you realize, I just don't think I'm going to be able to handle this pain, and you decide to get an epidural. That's fine. That's a choice, that's an informed choice that you can totally make. Some of the mindfulness practices that we will do today, the breath work, the guided meditation, will just help your brain kind of go with the flow as you have these changes to your birth plan happening. Let's say that you've labored for hours and hours, and we need to, you and your physicians or your prenatal care providers have decided it's time to go in for a C-section. What having this really strong mindfulness practice will do is kind of help you navigate in those kind of choppy waters of indecision, and that, like, last minute decision of having to change what your birth plan was to a different scenario. Having that mindfulness approach will really help you kind of go with the flow a little more, will help you release any sort of maybe guilt, or like, I get a lot of my clients who come back to me and they feel a lot of guilt and shame for their birth plan not going the way that they had hoped it would. They feel like their body has failed them, and that's not the case. But we do want to try and prep our bodies and minds for whatever may come our way on our birthing day, and that's what we're going to talk about today. So we're going to start with just a little breathing exercise that will get us all synced up with the same breath. Will relax our heart rate, will relax our nervous system. So I invite you to take a hand to your heart, it does not matter which one, and a hand to your very low belly. So if you have a nice big baby belly, take it as low as you can on the bottom of that belly, bottom of that bump. If you'd like to close your eyes, you can, and if not, you can keep them gently open. Just find a focal point on the floor that you can let your gaze be very soft on, and we're going to inhale through our nose, big inhale, fill belly, fill ribs, and then exhale through your mouth as if you're blowing out a candle. Inhale nose, exhale mouth. Inhale nose, exhale mouth. One more time, inhale nose, exhale mouth. Very good. And I want you to just say to yourself, my body is wise, my body is strong, my body is capable. Very nice. My body is wise, my body is strong, my body is capable. All right, so I'm going to talk a little bit about a couple of my favorite birth prep postures and movements that I do with my clients starting at week 34. I'm going to talk about a couple of my favorite birth prep breath exercises that really help navigate through each phase of labor. So if you weren't aware already, some of you may already know, but some of you may not. There are different phases of labor, and your body will, if it knows how to breathe and kind of knows about those changes that are coming your way as you transition from the early stages of labor to active labor to the pushing phase, you will be able to breathe your way through these changes and navigate the stress and navigate just the physical sensations that can be kind of intense. Some say painful. I'm trying to kind of rewrite that narrative on birth being a painful, horrible thing to it being a challenge. There's intense sensations, there's intense feelings. I even will say that there can be some painful moments, but when we can approach them with our breath, with our mindfulness, with our movements, we can really find those painful sensations decrease into just a very maybe intense sensation. And we can embrace them with a little more awareness. And then we're going to do about a 2-minute guided meditation, and I'm going to walk you through relaxing your body from the top of your head all the way down to the tip of your toes. So I'm going to show you the first birth prep exercise that I love to do with my clients. This is a deep squat, and what you will need for this is either a banister, the back of a couch. If you have a bedpost that's really sturdy, you can use a door frame. And then depending on your level of flexibility, you may want to use a birth ball, or you can use a chair. You can use a bolster. So I'm going to demonstrate each one of these squats with those 3 props. So I'm using a chair. So I have a chair that I'm going to squat on. Now, if you have a lot of flexibility, you can squat all the way down. If you don't have a lot of flexibility right now, or this is just not comfortable for your back, I suggest getting a very firm pillow, couch cushion, a couple of pillows, and supporting your bottom so you don't come down so deep. But you want those knees up like near your chest, or as close to your chest level as possible, right? We want our knees really high. If you don't have a big, thick bolster or pillow or cushion, grab a low stool or an ottoman or even a low chair. Or if you have a birth ball, which I'm going to grab, you can use a birth ball too. The only thing about those birth balls is our knees don't come quite as high as we want them, but you can come up on your tiptoes and find yourself on your tiptoes to bring your knees a little higher. So what we do with our low squat is it's a low rocking squat or a shifting squat. And this helps to stretch and relax our pelvic floor, but it also helps as baby is rotating down through the pelvis, and babies kind of corkscrew their way down as they're coming out of your vaginal canal and your birth canal and your vaginal opening. So they're kind of corkscrewing down, and this rocking movement helps to open your pelvic inlet, your pelvic outlet, and helps them work their way down. Now, we just do this rocking from side to side. This can get kind of fatiguing, right? Especially if you've been in labor for a long time. So support yourself, support your body. You can do this in your bed. If you're in the hospital bed, they're designed so many of them have bars that you can hold onto at the bottom of the bed, or they can put the back of the bed up in a throne position and you can turn around and face the back of the bed and hold on to that. If you're birthing in a birth center, you can use whatever they have. If you're birthing at home, you can sit on the toilet. Although again, you're not going to get those knees as high as you want if you're sitting on stuff like that. So the goal here is to try and bring those knees really high and then to shift. And what I really like to add in here is vocalizations. So this is something that's really hard to get people comfortable with, but it is so valuable to make deep, low moaning sounds like this. What that does, as we moan, it relaxes our throat, it relaxes our breathing diaphragm, and then it relaxes our pelvic floor. And our pelvic floor's only job during birth is to relax and move out of the way for passage of baby. So low moaning, you can make the sound of Om if you're a yoga person. If you like to sing, you can do some deep singing. If you just want to, a lot of people are like, can I scream? And I'm like, well, the only thing about screaming is when we scream, we often tense up our face like this. And when our face muscles are tense, our neck is usually tense, and then our throat is tense. So we want to try and relax our face. And that's why the low moaning, just kind of relaxes all that, okay? So that's the first movement, those low rocking squats that are so valuable for training for birth. And I like to have you start those as soon as possible. So even though I start birth prep with my clients at 34 weeks, I often will start adding this move in early on in their second trimester, so they can just get comfortable with this deep squatting, because if you're not used to deep squatting, it can be quite uncomfortable. So then we have several weeks to work up to that. Second, we are going to work on some knee drops. So knee drops, again, are another movement that allow our femur bone, this upper leg bone, to find some internal rotation in our pelvic girdle here. And that helps to open the pelvic outlet a little more, create more space. So baby has an easier time making their way out, and it really opens up the pelvic opening. It also helps it's a great pelvic floor stretch. So a lot of times I see people doing pelvic floor stretches and hip openers with pregnant people, right? But what's really great to do too is those internal rotations of your femur and your pelvis, because we often do that external, that opening, but we want to get that internal rotation too. So finding either birthing ball, finding a chair. You can do these in a chair, and I'll show them in a chair because that's a little more, it's just a little easier to see on this Instagram live. So you hold onto the edge of the chair, you drop a knee down, come back up, other knee comes down. My entire bottom cheek is coming up off the chair, so I'm really allowing my knee to drop in and down, past my midline, over to the other side. Very good. All right, excellent. Let's do a couple more if you're doing these along with me. Very good. All right, one of the last movement I'm going to show you for birth, it's super, super simple, but it's so valuable. So you can do this, again, no matter what your birthing situation is. Let's say you've found that baby's maybe stalled a little bit. Getting up and moving can really help to get progression of labor kind of kicked back up. Babies have their own timeline, so sometimes labor does stall. Many times if you're in a birth center or at home, your care providers will kind of let those stalls ride out. Sometimes, not all the time, sometimes in hospitals, they try and progress you along because some hospitals want a constant progression. Now, I believe that many hospitals are getting so much better about this as the language around birth and the understanding around birth's timeline, changes. So, movement is really key in helping it along. So if you're in hospital, you can do this seated in your bed. You can do it bedside, even if you have an epidural in. So we're going to be doing hip circles. So if you are seated in the bed and you absolutely can't stand up, you can do this seated, and you'll just cross your legs however you can comfortably cross them, and we're going to circle. And we're going to get the whole spine in. So we're getting thoracic mobility here. We're going to let the head and neck kind of get into it to release some head and neck tension, because remember, we don't want any tension in the neck and the throat. And then if you're able to stand, this is what I like even more. You can hold on to the bed, you can hold on to your partner, you can hold on to the wall and circle your hips. Really circle those hips. Like, try and make the most exaggerated circles that you possibly can, and reverse. And you can also do pelvic tilts here with this. So pelvic tilt. And a lot of people are like, isn't that just a cat-cow? It looks kind of like a cat-cow, but we really want to focus those tilts on our pelvic region. Okay? Very good. All right. So those are some of the movements I do for birth prep. There are a lot more of them, and I typically will give my clients about 5 or 6 movements to focus on week by week. So try not to overwhelm them, but we give them lots of different movements to find. So if something doesn't work, they can try something else. Now we're going to move on to breathing. So I have a few different breaths that I use to transition through each phase of labor. We're going to work first on our diaphragmatic breathing, and then I'm going to show you one of the breaths that I do for the active phase of labor. So if you have your belly, you can bring your hands to your rib cage, wherever you can feel your rib cage. So if your belly's kind of pushing your rib cage out, just bring your hands to about wherever you think your ribs are. So somewhere right around here, right? That's pretty much where all of our ribs are going to be, or somewhere right about there. And try and relax your shoulders. So notice if you have some tension in your shoulders, and just kind of let that tension loose. All right, so we're going to inhale, and we're going to try and fill our rib cage up so it goes forward, out, and back. So think of your ribs like your lungs, like they have a balloon resting inside your rib cage here, and you're trying to blow the whole balloon up on each side so it goes out, forward, out, and back. So we're going to inhale through our nose and exhale through our mouth. Very good. Now notice my hands as I inhale, and as I exhale, they come closer together. Inhale, exhale. Very nice. So this diaphragmatic breath is training your diaphragm, which is super important during labor and delivery, because we want our diaphragm muscle to be working really well as we're breathing through birth. This is going to get more oxygenated blood to your tissues, to your baby. This is going to really help regulate your nervous system, which is one of the things that I don't hear talked about a lot during birth, is the regulation of the mother or the birthing person's nervous system. Nervous system changes can really throw us off during birth and can even stall us. So if we're able to regulate our nervous system, we can find a lot of just a beautiful navigation from phase to phase, or from stage to stage during birth. So coming back to that diaphragm breath, maybe in between contractions or waves, would be a great place to kind of center you. You can do this breath with your partner, so if you're not thinking about that, they can get in front of you and say, hey, let's do that diaphragmatic breath, and you guys can breathe together. Another breath that I do for active labor is the breath. Now, this breath is when those contractions are really starting to ramp up and get closer and closer together. We're dilated between 8 and 10 centimeters. You can also use this breath for pushing phase. It's very similar to the Lamaze style of breathing that was originated in the 1950s. So when the contraction begins to hit, when that wave begins to crash over you, you take a big organized breath, the biggest inhale you can, and you, it sounds like he, hoo, hoo. And you can keep taking breaths and doing he, hoo, hoo, as long as your exhale will allow you to do that, and just keep breathing until the sensation of the contraction starts to peter off. So it's like a wave. So that's why I like to call them waves. I saw them called this way once, and I was like, yes, that's exactly what it is. It's like a big strong wave that starts to crash over you with all of its intensity, and then it rolls down and rolls out onto the shore. So if you can keep that breath steady throughout the wave, you're gonna really find some really great coping skills with those breathing techniques. Lastly, what I love to do with my clients in their birth training and their training for birth is a lot of guided meditations. I have, I think, 2 guided meditations that are about 8 minutes long on my IGTV channel under Birth Prep and Pelvic Health. These are great to listen to. And you might be like, Jess, I don't like meditating. Guess what? Neither do I. It drives me nuts. I hate sitting still and trying to quiet my mind, because it's one of those things that's very difficult for me. However, if I can put on a good guided meditation and listen to that person guiding me through the phases of relaxation, I'm going to reap so much more benefit out of a meditative practice than trying to sit there and quiet my mind and do it myself. So I have a couple of free ones on my Instagram. I am working on growing my YouTube channel, and I haven't shared it yet because I only have a couple of videos, but in the meantime, my Instagram TV channel has a couple of great resources. There are also a lot of great guided meditations available on YouTube. There are millions, and I have listened to probably about 100 of them, and I have yet to find one that I was like, ooh, that wasn't very good. I would stay away from it. So I just think it's amazing that we have that many free resources available on the internet. But I'm going to walk you through a guided meditation today, and then we'll have about 5 minutes for questions should you have any. And I will also share some of my birth prep resources with you. So I would love for you to find a comfortable seated position, or you can lie down. If you are lying down, find yourself propped up a little bit. So one of the things that I love to do with my prenatal students is get them in a yoga recliner. So the yoga recliner takes a block and a bolster, and you just have a nice little kind of incline, almost like not quite 40 degrees, 45 degrees, but it's just enough to keep you elevated and then to give you a nice heart opening stretch. So it's a really wonderful way to relax into a restorative yoga posture while you're pregnant and while you're postpartum. So you can lie down if you'd like. You can sit up if that's more comfortable. We're going to take another hand to the heart and hand to the belly and just take 3 clearing breaths here. So in through nose, out through mouth with a sigh. You don't have to make sound, I do. In through nose, out through mouth with a sigh. Very nice. Now, if you're comfortable closing your eyes, allow your eyes to close. If you want to keep them open, find something that's not moving to focus your gaze on, and just close your eyes a little bit. So we're going to imagine that we have a ball of like a dollop of butter on top of our head, right here at the crown of our head. Everybody knows what a dollop of butter looks like, and we're going to imagine that it begins to melt down into our brain space and fills our brain with this warm, kind of liquidy, relaxing sensation of just melting, releasing tension, releasing temporarily any thoughts that you might have of to-do lists, of what am I going to make for dinner, of I've got to pick so-and-so up and get them over here. Release all those thoughts and allow this ooey gooey brain butter to just melt down into your brain space. Fill the space between your eyes. Fill your cheeks and your jaw with this warm relaxation. Notice if you're clenching your jaw or if your tongue is stuck to the roof of your mouth. And if it is, unclench, unstick. Maybe give your jaw a little stretch and allow that butter to keep on melting down through your jaw into your neck, relaxing neck muscles, relaxing throat. Butter keeps melting down into the space of your heart and warming your heart with these nurturing feelings of relaxation, of release, of stillness, of tenderness. And then that same feeling melts down into the space all around your baby, all around your belly, and just kind of envelops them with this protective, loving, nurturing sensation of stillness and relaxation. And then it keeps on flowing down into your pelvic bowl, relaxing your pelvic floor muscles, relaxing any tension in your pelvic area, in the sacred pelvic bowl that we will be prepping soon for baby's arrival. And then I'd love for you to just kind of remember how this warm, relaxing, nurturing feeling feels, and allow that to sit with you as long as it can. And then we'll take a deep breath in through nose, out through mouth. Very nice. And you're welcome to stay right here in your relaxation spot, wherever you were, if you were lying down or if you were seated. I am just going to share with you all that I have a handful of appointments left on my books for birth prep sessions, for birth training, for postpartum and pregnancy corrective exercise and prenatal yoga. My books are filling up very quickly, but I have a couple of spots left. I do live birth prep and prenatal exercise and yoga on the Zoom platform. So we will meet whenever our schedules allow it, and we work together via Zoom in the comfort of your own home. So if you are interested in that, definitely reach out to me and send me a DM. Also, if you have not yet joined our newsletter, send me a DM after this live is over with your email address and just say, please add me to your newsletter, and I will get you on there. In that newsletter, I also have a link to my Your Empowered Pregnancy and Birth course on udemy.com. And I just discounted it for like a Christmas in July, if you will, sale. It's usually $45. It's a 7-hour course that has very specific exercise routines, prenatal yoga, mobility practices, breath work, and guided meditations for each trimester. So you can do all of the first and second trimester stuff in your third trimester as well. So if you're nearing the end of your pregnancy, it's still super applicable, and there is a bonus birth prep session with breath work and exercises for your birthing day. So it's going to be oh, you're welcome. You're welcome, my love. American woman, thank you for joining me. And so the Udemy course is usually $45. I discounted it for all my IG folks here today to $24.99. And once you buy it, you own it for life. So it's a great little investment. If you have a baby shower coming up and you somebody says, I'd like to get you another little something, that would be a great thing. So let me know if you need the link. I'll post the link actually in my stories tonight, so that will be another way that you can find it. You're welcome, Tiara, so thank you for coming. Let's see, Sonia, thank you for coming. It was so great to spend this time with you. Gotta be kidding me, I just love that name. That's the cutest. I just get such a kick out of all the cute Instagram names. So thank you all so much. I will try and post this IG live at some point for those of us, or for those of you that might have missed it. If you had some friends that were hoping to join, you can let them know that I will be trying to post this IG live by the end of the weekend. But if not, keep an eye out for in my stories for your discount code to your Empowered Pregnancy and Birth, and then send me a DM if you'd like to be added to our newsletter. Oh, thank you, Mira and Michelle. Oh my gosh, yay, congratulations. Happy due date. And I will see you all next time. So have a wonderful, wonderful weekend. Bye.